All these years, I have worked with neurological conditions. Patients come to us with different diagnoses. It can be a stroke, brain injury, it can be Parkinson's, or it can be a surgical, resection of the brain tumors. I've seen a lot of patients having brain tumors removed or resection, and then, they need some kind of a therapy intervention. It's a physical, if it is an acute rehab setting, then, it is an intensive form, multidisciplinary approach for getting this patient independent as close as possible. So they get 3 hours of therapy. I know you have that question for me ahead, but I just want to recap here is that, depends on what kind of interventions they need, whether they need at a subacute level. If the patient cannot handle 3 hours of therapy, then we do provide that at the subacute level, up to the patient's level of tolerance. If the patients are coming to acute rehab, they are given 3 hours of intense therapy. That means, they get physical therapy, occupational therapy, speech therapy. And again, it's a multidisciplinary approach. There's a physician, a rehab physician, who is the director of that program. And then we have psychologist, a case manager, and then of course a dietitian. It's a team approach it's a patient-centered. The goal is to get the patient is in the center, and we all help this patient in different areas. So, going back to your question with the neurological, as an occupational therapy, we look at this patient, are they able to get up and do what they need to do for their daily living? It starts with, getting up, going to the bathroom, going to be able to take showers, brush their teeth, self-feeding. And then, we also look, as the patients are getting better, can they move on their own? Can they walk on their own to where they need to do? And then, at the higher level, when I did like 12 years of home and community reentry program, at that level, the patients would be like, can I go back to work? Can I get back to driving? Can I do things that I used to do prior to all these events? So that's, the higher level, we can get the patients back there.